The following segment is sponsored by Northern Nevada Health System.
We're with Tyler Malcolm, an emergency department nurse at the Northern Nevada Health System, to talk about trips to the ER. Good to see you, Tyler.
Good to see you.
Appreciate your time. So what type of information will we need to share when we register at the ER when we come in?
I think the most important things that you can bring with you are your driver's license and your insurance card. Knowing your social security number can also be helpful in identifying you and getting you into the system a little bit more quickly. But if you can bring at least one, if not all of those resources, it's very helpful for us to get you registered appropriately, correctly in the system, and then we can start the triage process and start addressing some medical problems.
Stuff people typically have in their wallets or the purse
Typically.
anyway, and then most people memorize their social security number.
Yeah. And if you're on the way, kind of coming from the house and you're in a hurry, it is good to grab. If you can't, that's fine, but it is something that's very helpful to get that process going.
Very good. Okay, so why is medical history so important at the ER?
Medical history is really important to know just for education for yourself and just to know and be able to tell people in the public as well as your family. It's very important to communicate to your healthcare team in general because it can help us with diagnosing and treating the problem that you're presenting with. Oftentimes we'll see chronic medical problems are really affecting the acute issue that you're coming into the ER for. And it does also help us with managing medications, what kind of imaging we can utilize during your visit to the ER and through the admission process, if that is what it takes.
And if we're unable to, care or speak for yourself when you get to the ER for your visits, who will advocate for me if I come in and I can't speak?
It's a really good question, actually. So if we have somebody that can't really care or speak for themselves when they come in, the first thing as an emergency team that we do is we try to reach out to a next of kin. Next of kin can be anybody from a spouse, sibling, parent, child, anybody that has decisional capacity to make those decisions for you. I think it's important to note that if you do not have a next of kin, if we're unable to reach them, if they're not in the area for some reason, as a healthcare team, we also will personally advocate for your care and always try to support those decisions that you have made in the past when you were of decisional making capacity.
Very good. Tyler Malcolm, thank you. I really appreciate it.
Definitely.
And for more on all of this, go to our website, mynews4.com.